So there's a pandemic going on, right? And you've probably seen this graph and you think, what does this mean? And what is with all this social distancing? Why are we closing schools? Why has the NBA canceled the remainder of its season? What's going on? Three lines of defense you have against a disease: exposure, contraction, and your immune system trying to fight it. But let's do that with an analogy, since it's Girl Scout cookie season, of Girl Scout cookies. Let's say I don't want to ruin my diet with too many Girl Scout cookies. I could keep myself from having any by limiting my exposure to Girl Scout cookies. If I refuse to go out to any stores where there are booths and I refuse to answer the door when the Girl Scout rings the bell, then I will certainly not buy any cookies at all. That's where we are currently with the COVID-19 coronavirus. We are trying to keep people from being exposed to the virus, and that's what all of these social distancing policies are for. If you're not exposed to it, you can't possibly catch it. What happens if you are exposed to it? Well, that doesn't necessarily mean you will catch it. Similarly, I might end up having to go to the store, and just because I see the cookie booth doesn't mean I have to buy a cookie from them. If you are exposed to a pathogen, you won't necessarily get sick. Sometimes your body can block it, can fight it off before the virus or bacteria or whatever, in this case a virus, can get a hold inside of you. That's made even more likely if you've been exposed to it before, because then your body already has some defenses called antibodies to fight against that particular disease. That's where vaccines come into play too. They give you a weakened form of a pathogen ahead of time so that your body already has defenses, and when you meet the live virus, you're ready to fight and keep it from getting a hold inside your body. With this particular virus, we don't have any vaccines yet because it's too new, and we're probably at least a year away, probably more, from having one. So then the virus is inside of me, just like I failed and I actually bought some cookies from the Girl Scouts. Do I have to eat them all at once? The answer is no. I could try to resist. Just like your body is now resisting if the virus is inside of you. It's going to be attacking it, trying to fight off the virus before the virus can harm you too much. That's made easier if we have medicines that help to fight the virus as well. Unfortunately, again, the COVID-19 coronavirus is just too new. We don't have any medicines yet. So of our three lines of defense, the only one that public health officials can do anything about is the exposure. Think about the cookies for a second. Now let's say I have 1,000 cookies in my home. If I eat those 1,000 cookies and I break it up over months or a year, that's not going to be so bad for my diet nor so bad for my stomach. But if I end up eating all 1,000 cookies in 1 week, my stomach can't handle that, and of course my diet is going to just be gone. This is where we are with flattening the curve. When we have exposure to the virus, if we have too much exposure at once, if too many new cases are happening a day, that's that first tall curve, then what happens is the healthcare system gets overwhelmed. There's too many people coming into the hospitals all at once, there's not enough tests, there's not enough beds, there's not enough anything that anyone can do. So by spreading it out, by making the disease progress more slowly, even if the same number of people ultimately get sick, but we can spread it out over a year, we'll never get overwhelmed. It also gives us more time to develop those vaccines, more time to develop those medicines, more time to help us. So yes, I'm going to eat 1,000 cookies one way or the other, but wouldn't it be great if I spread out the amount of time it took me to eat all 1,000? And since we don't want to end with a pandemic, let's end with a cookie.